Hey, ni hao. Hashib Ben Asmah Yishang. This is Ben Asmah again from Nanchang University, China. And my previous two videos attracted a lot of comments and a lot of questions as well. So I just want to say thank you to anybody who sent me a message or subscribed my channel. Thank you, and big shout out to Prince Ankara, Russia. And I'm here because I promised to share my experience with you. I took the exam on 14th of April 2014, and today is 15th May, so exactly 1 month today. And unfortunately I failed in the rare test too. And I know that sounds ridiculous, but that makes me unique. I mean, the only guy who is sharing his failure experience. Yeah, and I'm not sharing this, experience, my failure experience, just because I promised, but because I believe that even though I cannot guide someone to score high in the exam, but I can clearly guide someone not to repeat the mistakes I and so many candidates did. So yeah, and this is my results. My name, and then the date, and 146, and then the fail. And 146 is one of the lowest score anybody can ever get. And I may be smiling now, but I couldn't believe my eyes when I first received my result. I went through all the stages in grieving, from denial, and now I accepted it. So yeah, and I think the biggest mistake that I and so many candidates do is that we think that step 1 is just the basic medical courses and step 2 is the clinical courses, and that's a misnomer, because as Dr. Francis of past program put it, he said when you go to USMLE website, the video, the vineyard video for both step 1 and step 2 are the same. The only differences are the questions that they will ask under step 1 and 2. Maybe step 1 they will ask you drug of choice or side effect, and step 2 they will ask you about the management. So basically, if you don't understand that vineyard, that clinical aspect of it, I don't care how many times you read first aid, it's not going to work out. So that was the first mistake I did. I also heard that it was just basic, so I set my goal to take it after 3rd year. And here in China, it's a 6-year program, and so the first 3 years we use it for mainly basics. And those who teach us do not have that clinical background. And so mostly the things that we do here are not, the basic science that we do here are not clinically correlated. And so I think that was the problem that I had. So yeah. And as Dr. Dakidi of Kaplan Medical also said, he said the exam is not just to test your knowledge, but your ability to correlate ideas under time pressure to come up with the best answer. And I think we all know, because if the questions were asked like individually, like you are presented a case and asked what's the diagnosis, or what's the drug of choice for pheochromocytoma, or maybe what's the side effect of phenoxybenzamine, I think about 80% or above of the candidates will get the whole questions correct. But what if they present a question like a 27-year-old patient came in with tachycardia and orthostatic hypotension, and according to the history he came in about 5 hours earlier with we complain of excessive sweating, headache, flushing, and maybe increased heart pressure, and then you suspect that his current symptoms are due to the drugs which were given previously. So what is the mechanism of action of those drugs? And according to the vineyard, when you think about headache, flushing, increased heart rate, and excessive sweating, it pushes your mind towards pheochromocytoma. And we know the drug of choice for pheochromocytoma is phenoxybenzamine, which has the side effect of the reflex tachycardia and orthostatic hypotension. And so now the real question is, what is the mechanism of action of phenoxybenzamine? And we all know that it's a non-selective alpha blocker and it blocks irreversibly. Yeah, and this is not a standard question because I just put it out of the air, but that's how the whole questions are set. They are set in 2 to 3 dimensional thinking process. Yeah. So I think it's not that easy, but I think when you go through this experience, you become confident and you come out of the other side of the tunnel as, a confident physician. So I think it's worth the effort. And I got this question so many times before I took my exams, and I know it's on someone's mind, if not on yours. And the question is, what if I fail? What if after, preparing or sacrificing my money, my time, my family, my relationships, and I fail? And my answer has always been the same, that if I fail, and so what? I mean, will I be the first person to have ever failed in life? The fear of failure has kept so many people in their comfort zone that they do not try things. And when you look in the history, all those people that we celebrate now, they mostly failed. They failed one time or sometimes multiple times. But now, because some people will talk about us, or when we will feel ashamed, we don't try things. And I read where they said, when the voice within is louder than the voice outside, you've mastered your life. So yeah, for me, when I set out to take the exam after 3rd year, because I'm the first person to take it in my whole university, so people told me, man, you can't do that. And mostly, if somebody have done it before, but mostly the people, international students or graduates who write the exam, they graduate before. So people advising me you have to wait and graduate before. But I had already set my goal and I didn't think about it. So I just set forth and just went, and here I am. And Michael Jordan said it best when he said, if there is one thing that I've done in life, it will be taking chances. And I either failed or succeeded, but I took those chances. And he also said that I failed over and over. That's why I succeed. And Thomas Edison, the greatest inventor of all time, was asked after he failed 10,000 times in inventing the light bulb. He was asked, Mr. Edison, you failed about 10,000 times. Why don't you give up? Why don't you stop wasting your time on this light bulb thing? And he said something that really changed my thinking on failure. He said, I have not failed 10,000 times. I've not failed once. I've found 10,000 ways that do not work. Now that I've eliminated those ways, I'll find the way that will. Wow. I mean, what can we not achieve if we see temporary defeat this way? That it's not a failure, but it's just a stepping stone to, entering my dream or maybe my destiny or anything. And Mr. Edmund Hillary, the first person to conquer Mount Everest, he said, pointing to the picture of Mount Everest, he said, Mount Everest, you defeated me once, and you might defeat me again, but I'll come back again and again, and I will win, because you cannot get bigger, and I can. So yeah, some of us have, tried things that we failed, or maybe are scared of trying something. But the point of the matter is, it's not about, doing something. You don't grow from just doing something. You grow from doing something you once thought was impossible. So yeah, for me or to anybody else who think, you have a dream, just go forth and make it happen. Don't think about what people will say or what will happen. So, and before I end this video, I just want to share a thought that, and I think this is mostly true for IMGs. If you're thinking that the exams is difficult or maybe the preparation is tedious, we don't have to take the exam. It's not compulsory that we take the exam. This exam is not a burden, it's a privilege. It's an opportunity for us to build ourselves. Just think about it. Do you know how many people will give anything just to be eligible to take this exam? Then hundreds and thousands of people are taking MCAT or incurring a debt of over $200,000 just to be eligible or to take their residency in the United States. And most of them will not get there, and we are here. So I think that we have to take advantage of this opportunity given us. Not everybody get it this way, but we are fortunate enough and we can prepare and get there. And maybe some people might be saying, I don't want to work in the US. I don't want to work in China either, but I'm here. And when I graduate, I want to go back home and to Ghana to serve my people. But the point is, I don't want to go back empty-headed. I don't want to go back as a mediocre. I want to be the best in my field that I can be in the world, and go back home so that I can contribute fully and not partially. I don't want to be a normal physician. No, I want to build myself before I go. So yeah, and sometimes you might set a goal and not achieve it, but you will always achieve something else in the process. For me, I'm in 4th year now, and when I pick internal medicine or maybe surgery book, I understand things that I wouldn't have understood without this process. And I've got so many friends from all over the world during the preparation that we encourage ourselves, that we share ideas, that we motivate ourselves, and all over the world. And I will not trade this above benefit for anything in my career. I will never trade that for anything. And so yeah, I think that this is an opportunity for us. So if you are thinking that maybe you will fail, or you don't know, if you don't try, how will you know? So yeah, and know that the greatest happiness of life comes from doing the things that people said you couldn't do. So don't let small minds talk you out of your dream because they think that you are dreaming too big. So yeah, this is Ben Asmah for you, and don't forget to subscribe. I'll be posting specific experiences and the progress of my preparation. I'll be preparing again, so don't hesitate to send me any message on my Facebook page. The link will be below, and I pray that God will help us and strengthen us through this process, because it's not easy without Him. And so I'm very happy and honored to speak to you.